unfortunately be moving on with their program from there.
So yeah. So next up will be Dr. Sai Kolla, who is a neurologist originally from Bhimavaram. Currently, he is a consultant for New York City Health Services and practices neurology in New Jersey. He previously served as a medical officer for the government of Iran and government of Nigeria. He will be presenting on stroke and thrombosis from the neurological perspective. Please start sharing your screen.
Yeah, hello, everybody. This is a wonderful presentation, especially from young students, reference to some of the disorders that cause thrombosis, and also is a very nice and promotion of this World Thrombus Day every year. Some of these students are taking part, really promoting the Thrombus Day for other students and also to the families, because this is the one causes several diseases, especially like thrombosis is like heterothrombus formation. Either it can be acquired or inherited. So acquired is the one which is to some extent it is in our hand, not only some extent, probably mostly. So as part of this thrombus, heterothrombus formation, which starts right from younger age and advances to the future level where thrombus will be formed and causes strokes. So that part is like we have to be careful about the obesity, which is the one causes inflammation, and the main thing is like avoiding the unnecessary fats, and the maintenance of the weight is very important. That in the later stage of life where you should not go beyond control. Inherited problems, most of them like blood disorders, some of them you people talk about it, and that is we cannot do much about it. Um, that various hypercoagulatory syndromes are there, especially younger people who get the strokes. They should be thoroughly investigated for those disorders. The thrombus, sometimes stroke comes and we cannot see what is the cause. Well, that is a very important thing. They present with a stroke, there is no cause there. There is no thrombus really. Heart is clear. At that point, the cryptogenic strokes, that is very important. And especially if they're present with a stroke, uh, occult atrial fibrillation, from the heart, again, the same thrombus formations in the left ventricle or left atrium. This can dislodge as embolia and causing strokes. Uh, with that occult atrial fibrillation, because COVID-19 can cause the heart problems like cardiac arrhythmias, which can cause embolia and cause the stroke in the brain. So that one is the problem where sometimes atrial fibrillation cannot be recognized as easily like with our normal investigations. That is one. And somebody talked about the malignancies, that is they present with stroke, and also the cancer will not be noticed at that time, but appropriate age-appropriate investigation should be done when there is no cause for the stroke um, uh, in the patients. Now, in COVID-19, again, the whole system is again thrombus is like it can form at any stage of the disease. like initially, or they present with stroke, that is the worst prognosis they have. 60% is bad prognosis, only 40%, and with a large amount of disability. So again, the cause is the same thing, thrombus formation. They say due to the inflammation of the endothelium, then also hypercoagulability that causes the thrombus. Again, in COVID-19, the best thing here is like acquired thrombus, which we can handle that right from the beginning by like young age. The COVID-19, again, as our Honorable Mayor told, the prevention is the best thing to avoid this COVID-19. Once it comes, is difficult, and especially the stroke is the worst prognosis, one of the worst prognosis it causes. So avoiding, people, social distancing, and also ending of the washing of the hands, and avoid it. And thank you for the opportunity to given to me. Thank you.
Thanks so much, Dr. Kolla. It is our great pleasure to have you here. To the delegates and the people who have joined, Dr. Kolla has served when the New York got really badly hit. He served the front line. He was on the front line and served a lot of people by telemedicine. So we respect you, sir, and it's an honor to have you here. Thank you so much.
Thank you.